Hi everyone, today I shall discuss about the articulated skeleton of the hand. If you identify the carpal metacarpal bone, it is easier for identification in the X-ray picture, as well as it is very easy to say during examination where we will get the full marks. Now you see our anatomical position palm is the palm is on this part, you will see front. So the articulated skeleton of hand, you should keep it in this way in the anatomical position, and you will see the thumb side, that is this one. You will see this is identify which side the bone belong. This is the right side, so you will see the thumb is on the right side. Now this articulated skeleton of hand, you will see there are 8 carpal bones, small carpal bones, and they are cubical in shape, and it is so faceted that there are out of 6 surfaces, there are 4 surfaces are articular. Now you will see these carpal bones, where they are so segmented, like that of the tarsal bone, they are also so segmented. Because you will see when the segmentation of the bone is present, the movement will be finer. You will see here, you will do different types of movement. You can playing actually the ball, the bat, you can playing the music, everything. If there is a single carpal bone, it is not possible for you that finer movement. So now how you will identify the carpal bone? The carpal bone are arranged in 2 rows. One is proximal row, another is the distal row. You see the proximal row, it consists of the boat-shaped scaphoid bone. This is the scaphoid, this is the separate bone of the scaphoid. It has got a concave area in front which is boat-like, and there is a tubercle that is known as the tubercle of the scaphoid. Now you will see the tubercle of the scaphoid, which you can feel in this region, that is the anatomical snub box which is situated in this region. Now it is important both because when we fall in the outstretched hand or from the cycle or from the bike, so what will happen? There is fracture of the scaphoid bone, and there is pain. If one does not care for the pain immediately, there will be the necrosis of this bone. So that is a dangerous event, and that will create tremendous difficulty in working later on. Next bone is known as the lunate. Lunate means moon shaped bone, and next is known as the triquetral. Triquetral means triangular bone. This is the triquetral bone, and in this triquetral bone there is a small facet. In this small facet, a small bone is attached which is known as pisiform. You will see this is the pisiform. So one can feel the pisiform. You can feel in your own hand this pisiform bone. So this is the proximal row. Next, the distal row. Distal row, from lateral to medial, we will see that there is the trapezium. Trapezium bone. Now this is the trapezium, and next bone, that is a small boot shaped bone. This is known as the trapezoid. Next you will see the largest carpal bone, that is the capitate bone, that means it has got an head. You will see this capitate bone, it articulates with the you will see this scaphoid bone. So you will see this capitate articulate with the scaphoid in this fashion. Next bone, you will see this is the hamate, the medial most bone which has got a hook, that's why it is called the hamate. You can feel the hamate in front of the pisiform bone, about 1 centimeter in front of the pisiform bone. So this is about the carpal bones, and you will see arranged in front of the carpal they are the metacarpal bone. Now the metacarpal bone, they are the example of the miniature long bone with one epiphysis, but here I will tell you that there is difference between metacarpal and metatarsal is that metatarsal is long and it is thin and metacarpal is thick. So this is the metacarpal. It has got head, the broad shaft, and where you will get the triangular area. The first metacarpal you will see that is the both the upper end and lower end is equal, and this is you will see this is small. Second, third, fourth and fifth metacarpal you will get, and this metacarpal articulate with the phalanges. Similar to the foot, there are two phalanges in the thumb and in the other finger there are three phalanges. So thank you everyone for watching this video.